Hey, do you have back pain coming from a spondylolisthesis problem? For those of you that don't know a spondylolisthesis problem, it's when one bone in the lower back is shifting on another bone. It can cause disc issues, disc injuries in the back. It can cause nerve problems down the back. And the way this is commonly diagnosed is through an X-ray or an MRI. Usually, if you've heard the term spondylolisthesis, chances are you've gone to the doctor's office and you've had an X-ray or an MRI and you've been told this. So if you're watching this video right now and you're not sure what a spondylolisthesis is, then you may not want to watch the rest of the video. It may not be the right kind of help for your type of back problem. There's all different reasons for back problems. This information is specifically for somebody who's got a spondylolisthesis problem. Real quick, my name is Dr. David Minoff, and I'm a specialist manual physical therapist over at El Paso Manual Physical Therapy. And here at the clinic, we've seen all kinds of different back pain problems. We've helped people get off of pain medications, injections, and avoid surgery, literally get off the surgeon's schedule and successfully solve the back problem. One of the problems that we see in back pain patients is a spondylolisthesis. These are less common. There's a lot of other reasons why people get back problems like disc issues, muscle problems, muscle imbalances, muscle spasms, itis problems like tendinitis, those types of things, joints, arthritis. There's a slew of reasons why people get back pain problems. But a spondylolisthesis is a specific one where those bones shift. That's, like I said, diagnosed through an X-ray or an MRI. And it's especially dangerous because when those bones shift, there's a high risk, if it shifts too far forward, for a bone to break, a fracture to happen. And if that's the case, that's usually immediate surgery if it gets that bad. Now, there's signs leading up to this, like, for instance, people start having unrelenting numbness and tingling, like where it's just constant down the legs. Usually it's on both sides symmetrically. It's not just one leg, because it is possible to just get numbness and tingling or weakness in one leg, but not the other. That doesn't always present like how spondylolisthesis symptoms present. Because that bone shifts forward, it can pinch the spine, the spinal cord, the nerves within the spine, and that's why you get symptoms happening on both sides. Now, fixing this issue is actually kind of straightforward for us, as far as here at our specialty clinic. We can handle this type of issue very well as long as it's not too far gone and there hasn't been a fracture, obviously. If we detect that somebody might have a fracture here, we're not proceeding. They're going to the doctor, they're going to the surgeon. They need to get checked out by that person to make sure that they take the proper measures to fix this kind of back problem surgically if necessary. So hopefully yours isn't that bad if you know that you have a spondylolisthesis, and you'll be able to benefit from the exercises that I'm going to show you here personally today. So before I show you these exercises, I just want to talk to you about a routine with these exercises. Now, fixing a spondylolisthesis problem is a process. It's not something that happens right after doing these exercises. By the time you're done with this video, if you do everything, you're not going to have a fixed problem. That would be misleading you if I told you that. It's doing these on a consistent basis. And then after you begin to see some improvement, progressing the exercises, which can go a bunch of different ways depending on your specific activities that you do every day, your exercises that you might like to do, or your role at home or at work. And you just have to consider, are you more of a sitter? Do you sit a lot because that's the nature of your job? Or are you up on your feet quite a bit? At home, are you involved in the chores quite a bit? Or you have kind of a low maintenance home? Maybe you don't have kids at home and it's just you're taking care of, or there isn't that many things to do. Pets as well can create some work for you. And if you're very active as far as exercise, you like to go outdoors, hike, walk, you're in the gym, you have a gym at home, you have to consider those activities, and so you might want to go in different directions. But as far as the starting point, that's what I'm going to cover with you today. If you have a known spondylolisthesis problem, these exercises should begin to shift the bone back into position so that you can begin to get some relief and head in the right direction for recovery. So let me show you the first exercise. The very first one, you have to get an abdominal bracing maneuver down correctly, because this is going to carry over into other activities. So what you want to do at home is lie down on the bed or on the floor, wherever you're at. I'm going to lie down here. And if you put your hand under your back, so I got my hand flat here, I'm going to put it under my back. And then what you have to do is push your back down against your hand so that your abs also go down. It flattens your back against your hand against the table here. So just to do it again here, it's like that. You should feel your abs tighten up, which is a good thing. You might also feel butt muscles tighten up. That's also a good thing. When you do that motion, think of the spine bones. Like I said, one of those bones has shifted forward. When you do that abs in motion, it pulls that bone back into position using your muscles. Now sit on up and do this in sitting. I want you to sit like I am right now, and then put your hand behind your back and push in the same direction like you did when you were lying down. And you should feel the abs turn on similarly. Now go 100%. Go as hard as you can, 100%. Hold it there for a little while. You should feel the muscles tightening up. Now relax for a minute, for a few seconds, and then do it again, but go 50%. Not as hard, but same direction, same kind of contraction where your abs suck in. Hold it there and relax. Now just do 25%. We're gonna hang out here. So just lightly suck in the abs, flatten out your back. Your back should not curve more in the lower back. It should flatten out, because when you flatten out, you're pulling all those bones backwards into the position that they should be in. You don't want a big accentuated curve in your low back, because that means the bones are going relatively forward. You want to suck them back. Do this, and I need you to get good at holding it for 10, 20, 30 seconds, minutes, at 25% intensity of doing this. If you can do this while you're driving, while you're sitting, while you're standing and walking around, while you're doing the house chores, while you're doing your desk job at work, if you can begin to do this more often throughout the day, you can suck those bones back into position, allow your discs to heal so that they can hold them there. You're not having to do it so consciously with your muscles. It can take off pressure from the nerves, and it can begin to put you on the right course to healing this spondylolisthesis problem. So I want you to right now practice doing this for as long as you can. So let's just do 10-second holds 10 times. Flatten your back. Let me do it with you here. On your back, and we'll do some in sitting as well. So you just go like that, hold it for 10 seconds, and then relax, and then you're gonna repeat, hold it for 20 seconds, get control over these muscles, involve the backside muscles as well. After about 10 seconds, relax, and just keep doing that motion. You need to get good at doing this so that you can do it on command and shift those bones into position. Because if you're not doing this consciously right now, chances are your bones are going more forward and you're feeding into the problem. The bones are shifting more forward, the nerves are getting pinched, the disc is getting stretched out, you're setting up arthritis, and worst case scenario, you're gonna get a fracture in your back, and you don't want that, because then you lose a lot of stability. So here in sitting, suck in those same muscles, pulling your abs, and hold it there 10 seconds. And what you want to do over time is get good at doing this throughout the day so that you can hold it for 20, 30 seconds, minutes. I went to school in Austin. I am from El Paso. It's about an 8-hour drive back and forth. No joke. When I figured out this process with the abs, I would play a little game with myself and watch all the mile markers on the side of the road. And I would tell myself, okay, I'm going to hold my abs in just like I'm showing you right now. And I'm going to do that 25% for the next 5 mile markers. And it gets pretty intense. It takes about a minute roughly to travel a mile out there in I-10. And on that road, being there for 5 minutes at a time, my abs are killing me. And after repeating this process over 8 hours, the next day I felt like I did a ton of sit-ups. But my back felt great. Never had any back issues from sitting for 8 hours straight, minus little pit stops here and there. So I challenge you to do this all day long. This isn't like one where you necessarily sit down. I mean, you do practice at the beginning just to figure out the motion, get your muscles going. And I want you to take some time where you just lie down or sit up and do this motion. But eventually this needs to be happening in everything that you do. Sitting, standing, anytime you're upright pretty much. Okay, I'm gonna move on to the next exercise, number 2. Knees to chest. So for this one, this also helps to shift the bones, and this is one where you're gonna get some help from your legs. So also suck in your abs like we just did. So you're gonna practice that same maneuver, then pull one knee in, pull the other knee in, and just hang out here. This is especially good if you've got constant pain. like it doesn't stop hurting. Usually, as long as you're sucking your abs in, pushing your back flat, you can shift the bones into the proper position and get some relief within the spine. And it takes some effort. Like, I'm not just hanging out here. If I was relaxed, I'd be like this, but I am pushing my back down. It is working in my abs to do this. I feel a very subtle stretch in my low back. You should feel similar sensations. One of the things that we tell our clients here all the time is the way an exercise looks is one thing, but the way it feels is another thing. Because we often get asked by our clients, am I doing it right? Will you look at me? And I tell them, it doesn't matter. I mean, I'll look at you and I'll tell you, but what do you feel? Do you feel the right muscles working? Because if so, you're on the right track. Our bodies are all shaped differently. And if your movement looks different from somebody who's shorter than you or taller than you or wider than you or longer than you, all those variables can change slightly how the movement looks. But as long as you feel, in this case, those abdominals tensioning up, you're on the right track. So do that. Hold it for 20, 30 seconds. And if you feel like your muscles are getting tired, then go ahead and relax. What I don't want you to feel is muscles right here working, because these are your hip flexor muscles, not your abdominals. Abdominals are on the abdominal area. Hip flexors are on the thighs. They go into the abdominal area, but you'll feel them working usually right here. If you're working your hip flexors, the interesting thing about the hip flexors, their influence on the spine is they pull muscles forward. So if you're doing this knees to chest movement right here, and you're not really working your abs, and you're just kind of hanging out, and you're even pulling it in with your legs, you're going to work those hip flexors, and it's going to yank the bones more forward. A common mistake that people make whenever they're thinking about working their abs for their spine, for their back problem, even for a spondylolisthesis problem, is they'll do leg lifts. So they're picking up their legs and holding like that, and they're feeling these muscles work quite a bit, but really they're pulling their spine bones more forward. It's better to focus on using these muscles here. So just suck it in right there. Feet don't matter. You can have them crossed or not, whatever you want. Just make sure you're sucking in those abs and getting your back flat so that you're shifting those bones into position. So a good number of reps and seconds to get up to on that one would be 3 sets of 30 seconds each. And you can do this as frequently as you want. Get into a routine of doing this as much as you need. Think of these exercises as medicine. Like a physician would give you medicine. He'd say, hey, you weigh so much, you're this old, you're this gender, you need 800 milligrams of this medication. It's hard to dose exercise because it depends on your fitness level and your irritability. So you've got to figure out the dose by saying, okay, this feels good, too much, no, more than 30 seconds hurts. Or, you know what, 30 seconds didn't really do much. Let me go for a minute. Now I feel some relief. You can play with it. But these motions, the way that I'm telling you to do them, are a good thing. You've got to figure out the dosage on your end. Okay, one more exercise here that's going to give you some relief, usually instantaneously, but also begin to strengthen the muscles so that you get more long-term relief and you build towards progressing these exercises. It's an angry cat exercise. So it looks like this. You're going to get on hands and knees. You can be flat-handed or fisted, it doesn't matter. But then once you're right here, what you've got to do is suck in the abs. So it's the same maneuver like we've been talking about. When you pull this in, your back should round up here, like you're pushing it up. Like an angry cat arches their back whenever they're angry. Hold it there for 10 seconds, and you should feel your abs working a bit. And then just relax. Just make sure you don't relax all the way down. Kind of come to the middle. And then come back up, hold it for 10 seconds and repeat 10 times. This exercise gives you movement within the spine, but makes you use the right muscles so that you're sucking those bones back into the position where they're supposed to be. Now, what you don't want to do in this exercise, it's a yoga move, by the way, the cat camel or cat cow, I forget which one exactly. But when you come down this way, you're pushing the bones forward on your body, which is the same direction that they're involved in a spondylolisthesis. So it's going to feed into the spondylolisthesis problem if you come down this way. So you got to only come down to the middle. So come all the way up, hold it for 10 seconds, and then relax to the middle and repeat. Doing these exercises diligently sucking in your abs, doing the knees to chest, doing that angry cat exercise should begin to calm down the symptoms. Once you calm down the symptoms because you've been pulling the bone in the right direction, it then sets you up to begin to address the long-term muscle imbalance so that you can solve this spondylolisthesis problem for the long term. In order to get the next steps on what to do, you can go see a physical therapist. Of course, I'm definitely a biased fan of manual therapists. I think we have a special understanding of how to handle certain things without surgery. Whereas most physical therapists are excellent at handling a post-operative case. Like if you've just had back surgery, you can go to just about any physical therapist and they'll help you out fairly well. Everybody's pretty good at doing that. But handling a non-operative case, like if you've never had a back surgery and you're afraid of getting one and you want to make sure that you take all the proper steps so that you don't end up having surgery, so that you're not having to rely on medications or injections, then seeing a specialist physical therapist is going to be your best bet. Now, another option, if you're stuck at home or you don't want to go out, is we have a program where we put in our own progressions, and it's not a specific progression for you, obviously, it's more of a general one, but it's a darn good set of progressions that can help out a spondylolisthesis problem. We have a program called the 28-Day Back Health and Wellness Boost Program. This program covers a few exercises like this that are kind of beginner level, but then it goes into more advanced stuff. And as you get stronger over the course of 28 days, in this case of a spondylolisthesis, as you suck the bones back into position, you can begin to fortify, to strengthen the muscles around the bones to keep it there for the long term so that you can heal the disc, heal the nerves, get the muscles normalized, and proceed through life without being afraid that you're going to make it worse and have that fracture situation pop up. So if you want to learn more about that 28-Day Back Health and Wellness Boost Program, just go to the description below here and you can find out all about it. Well, I hope this was helpful for you YouTube friends. If it was, please give us a like right here and also subscribe to our channel so that you can get our exercises whenever we put them out, or other helpful health tips that might get you away from having medications and injections, and of course having to have an unnecessary surgery, because you can usually prevent them through natural means like what we offer here. I hope that you have the best day, and oh, don't forget to share our video with somebody that you think could benefit from this. You'll make their day as well. Talk to you soon. Bye-bye.